So that's a quick schematic, if you will, on females. We're going to talk about crown, and crown is great because, again, it is an advanced topic, but what's fun about the crown is really to show you that every element of hair transplantation is actually exciting and creative and can be so. So these are just tools. You're not going to memorize everything that I tell you, but you're going to start going home going, hey, you know what? I'm going to approach this situation in a strategic way, and that's part of the fun part. So, you know, how do you explain to someone what they don't see, right? They usually are focused on the front. And as I said, as you've heard a lot of speakers talk about, the front is probably the most important in the majority of patients that come to see you. But you really have to present all sides of the picture. What does that mean? What it means is there's actually not just the baldness from the back side of the scalp. It's actually from the side view. You can almost see someone, if they're balding from the side view, that they're losing hair because they've lost that fullness. And even in the front view, some of that hair can contribute to the frontal loss as well, because part of that hair arches up and over, so it actually contributes to frontal visual density. Who's a candidate? Again, this is you have to pick your candidate, because if you start working on a very young patient, you're going to have this little patch of transplant hair on the back and a weird halo around it with loss everywhere else, and you can't fix it because they're too young, and it takes so much hair to do so much hair to do a crown well. So who's a candidate? This is not an absolute. I've done younger patients than 35, but in general, this is a good rule. But when you hear this, I don't want you to go home and go, there's a 40-year-old patient, I'm going to do him because Sam told me, 40 is safe. It's not always safe. Sometimes 60 is not safe. And sometimes what this is a ratio, and you're going to have to develop this judgment of donor to recipient ratio of do you have enough donor to cover the recipient, and do you have enough donor to cover the recipient for the future, and other areas that may be involved, like the front, etc. So is the front done, or is it not needed? So the crown is a great choice if someone has great donor, has maybe hopefully less extensive recipient, and maybe the front doesn't need to be done, and so you can just get all that and focus it on the crown, because the crown takes more grafts than you think. And part of the reason is, as you heard from Tony, is when you wet that hair, it starts to open up and you go, wow, this is twice as large as I thought it was going to be. And the crown doesn't grow quite as robustly as the front, and there's some other issues we'll talk about in a moment. Other issues, make sure everything is as stabilized as possible. You heard in my female talk, you want stabilization, you want optimization, you want to be thinking about the crown not just as a surgical intervention issue, but also as oh, wait a second, hey, maybe medicine is a good alternative, maybe medicine is a good adjunct. So these are components that I would highly advocate you looking at. And then also, as I mentioned, you start to get judgments. And one thing I encourage you in lab this afternoon, and we've done a little bit of it yesterday, is don't just get focused on the inanimate models of technique. That's critical you do that. That's why we have the lab. But you also, if some of the group Bs yesterday may have heard the lecture, and the group A will hear it today, from Dr. Jimenez from Canary Islands, talked about coaching is so important, and coaching can only be done on a very intimate level. You can't do that with 80 people. This is a lecture, it's not a coach. So when you're in that environment, when you've got these world-class faculty, sit down with them and work on it on a level, and work in a Socratic method. So use each other's scalps. Don't be embarrassed with it. If someone's got a Norwood 2, 4, 5, let's look at this. Let's look at the donor. Let's look at the ratio. If you have a little bit of thinness in the crown, can you be done? Is it safe? Start to develop. The more cases you see, the more you develop the experience of understanding who's safe and who's not safe. So this is all very important, and as I said, the crown oftentimes underdelivers, and I will tell you, I tell every patient, if I'm working on the crown, expect that you may need a second session. Even if I'm not expecting it, I still expect it, because the crown can underperform. So it's important that you don't overpromise and underdeliver with the crown. Hair patterns, this is just different patterns that can exist. Ziering did this. It just talks about, this is more academic. If you're going to look at what you have there, and I'm going to talk to you about more design elements. So it's good to know this. It's probably maybe on the board, but these are just ideas. These are different crown loss patterns that are out there. The last one with the coronet pattern is important to remember because there's some loss that can occur a little bit lower, and I'll show that in a moment. I think, is it Biener that came up with this? Is the idea of the billboard effect? It's important because remember that box idea I showed you? Where is the crown situated? It's on the vertical plane posteriorly, right? So if it's on the vertical plane, you're looking dead on it. So when you're looking at baldness on the horizontal plane up here, you can layer your hairs like this and you don't see the plane of baldness as badly. And so remember, what is baldness? It's looking at scalp. So if you look at scalp on a tangential level, horizontal plane, you can do a lot more to mask it. But when you're on a vertical plane, it's dead obvious. So it's harder to camouflage. Plus, these grafts splay open. Okay, so we're going to talk about strategies of minimizing that splay in a moment. But the billboard effect is ever present, and I oftentimes use this terminology to help patients understand why it's harder to get that crown done. So let's talk about planning the donor area. Look for that coronet, wet the hair if you like, and look at really start understanding that the crown is probably bigger than you think. You need to be generous in your donor harvesting, and you need to be generous in the number of grafts here. This is why it's an area of advanced topic, and all the other aforementioned reasons that I have given already. So the initial plan may be here, but when you wet the hair, you may start going, hey, oh my God, I got that or more. And what's interesting is that in an older patient, you may be doing this, but in a younger patient, you've got to worry about progression, and you have to go a little more aggressively there, because maybe if they're on the younger end of the spectrum, within a few years that starts to open up more than someone older. So female crowns, you've heard before in the last talk about the Dumble design, is just these are just schematic concepts, not meant for you to. These are not testable. They're just for you to have little ways to help remember things. Regions of the crown. Why divide it? It's just architecture. Is a way for you to help think about, for you to be able to be conversant in the crown and come up with strategies and design. So it's a center whorl where the crown begins, the upper arc, the lower arc, and the transition zone going from vertical to horizontal scalp. Okay, so transitions. Remember what I said, there's nothing abrupt. So remember that when we go into the lateral hump, everything is arching out this way. When it's going to the mid-scalp, it's going forward. When it's going down into the donor area, it's going out this way. So you'll see that from the central whorl, as you go out, the transitions are subtle. There's a gentle transition. Nothing is abrupt. Really try to think gentle transitions with all design for all parts of the scalp, for all genders, for both genders and all ethnicities. So design, preferred design, why? Let's articulate this more in detail. So it's part to do with the hair part, the comb direction, and covering the crown. So what's interesting is in the past few years, I've emphasized the hair part in the comb direction. I've now completely changed my idea in the last year. So part of this is just reconceptualizing what is important and why. So I actually take that covers the crown, which is in bigger words, as more of a priority. So this is a little bit different lecture from what I've done in the past. So looking at this, these numbers are prioritization and also design of the whorl in a certain area. So this is a high left whorl clockwise. In the past, I advocated a low left whorl. What does all this mean? What it means is every graph you put in can optimally give you an outcome. So if you have a hair, let's say in quadrant 4, okay, it's going here to cover almost nothing. Whereas up here, it's covering some of this and also cascading down. But quadrant 1, which is to me the most important, is going down and covering all of this area. Why did I think now that it may be better to go high than low? Here's the reason why. If we're on a vertical plane, it's harder for hair to arch up and create density and drop back down. So if if you start with a higher whorl, the whorl will start to fall down and cascade over it, and you get, to me, a better coverage in the crown. I'm seeing better results by covering the crown by starting high and focusing on quadrants 1 and 2 and going with a higher whorl point. So this is just some new ideas, and you constantly evolve your thinking. This is not right, and someone else's way of doing something is not wrong. These are just thinking. And if you're doing the exact opposite, which is the counterclockwise high left whorl, it's actually the same thing. And what does this all mean? It just means think about how you can leverage graphs, and that whole idea is packaged in the concept of of a word cascade. Cascade means if I can travel from point 1 to 2 with one graft and the other one has a small travel distance for coverage, you want that leverage of the longest travel distance to cover. And some people in the lab yesterday heard me say if someone maybe has a crown area that they can't quite cover, you can do more in the front and comb back. A comb over from the side is obvious, but a comb back is actually pretty good. And you can then maybe, if they have you could scatter the crown. This is a complicated, I'm not going to get too much into this, but the idea is that you can comb back over it and you can cascade over from the front to the back. I don't want to introduce too many variables in this talk. So the low left whirl clockwise, again, all I'm trying to do is leverage. This was my preferred design. Last year, year before, it was going up and arching over. It's still a great design. And this is the exact opposite counterclockwise, but all I'm trying to tell you is try to cover that space to the maximal ability, so you're not using grafts the same way. When you're looking at graft sizes, there are very few 4-hair grafts, but usually it's 2-hair grafts. But if you're having 2 and 3 hair follicular units, how can you leverage this for maximal outcome? Well, the way to do it is to look at using not only the density gradients, but also the size of your grafts. So I use 3-hair grafts in areas of maximal concern and 2-hair grafts in less maximal concern. And I've been going, I was using combination sagittal coronal sites. I'm now almost all sagittal for a few reasons. Number one is coronal sites are really hard to follow in the crown for my placers and also for me. So sagittal sites are the easiest for me in the crown. And here's the other cool thing, and you're going to hear this in a moment in this talk, is why you didn't hear this too much yesterday because there were B issues, but sagittal sites, people don't do sagittal sites because they're worried that the sites, the recipient, the grafts will ride vertically. Well, I want the grafts vertical here, and I'm going to explain that in a moment. So it's the exact opposite of the frontal area. So recipient sites are designed for me with 18, 19, and 20 gauge needles. When you're starting out, your placers are not going to be able to place in 20 gauge, and don't force them to do this. So you're going to hear this, but you're going to probably have to use larger sites to make your sites, because your limitation is not you. You can probably use a 25 gauge, who cares? But the point is your staff won't be able to place. So make the site the largest size that your staff can place. So go a little more generous in the size and work with them. Make fewer sites, not as closely spaced, to try to get this result. So I'm not using any 20 gauges. I'm using all 2 and 3 hairs, no 1 hairs. If I have any 1 hairs, I'm working the crown, I'm going to pair them into 2. So these are just examples of some of the design work I've done. It's not a big deal, just to give you a feeling of this. But this is an important thing. We talked about angles yesterday, and the angles remember, there's no, in my opinion, there's no abrupt transitions in the scalp, and this also relates to this way, angulation. So remember what we heard yesterday, very low angles in the front. As we transition up toward the crown, in my opinion, it goes very high. Now, some people would argue me with it against this, and it's fine. My colleague would not be wrong saying something different than what I say. But why go high? Why go high here? One, I think it's natural. 2 is I think it gives you 3 benefits. 1, it gives you a rounder profile. Remember what I said, the side view is so important. Don't forget that. It gives you density. Why it gives you density? Here's the reason why. Remember that in the front, the density was afforded because the angles were low, right? It's shingling on top of the scalp. Well, when you're in a whirl in the pattern, you want that to be lifted up and then cascade back down. So that's the reason I think you're getting more density in the crown with this. Plus, if they're in a whirl and you make them really low angles, okay, they can't get tight enough. You're taking too much space below the skin. Does that make sense? So when you tilt it up, you can tightly arrange the order. So I'm getting 3 benefits by making these in a higher level position rather than very, very low. This is just a model to show you what I'm talking about. So here's a quick case study before we move on. So this is sorry, let's go back a second. This is a clockwise whirl starting on the right. So what I want to focus on the central area because of the cascade. These grafts will travel more than the grafts on the right. So I want to put stronger grafts in this area, plus I want to put stronger grafts in the area that I feel that are creating this light reflex up here, the vertex transition zone. So those are the areas that I find of principal importance. And then the other areas around it are slightly less important. They're not unimportant, but they're maybe slightly less important. This is just an element of design. Is this right or wrong? No, it's not right or wrong. This is just design. You know, if you like Picasso, you don't like Matisse, this is design. You're trying to think creatively as a physician, and I'm trying to teach you that. These are just after the grafts have been placed. So you may have heard in the world of rhinoplasty a Gunter diagram where you have you do a rhinoplasty and then you make notes. I always do a Gunter style diagram after a rhinoplasty. But with hair, there's also these diagrams. In my EMR, electronic medical record, I'm always designing and recording every individual one. Why am I recording each one? And the reason for it is that my staff, it's a blueprint for them to record, to see how to design it, and it's a record. So in the future, I can go back and say, how did I do that? Well, I have exactly how I did it in a diagrammatic fashion. So these are just some more complicated whorls, a double whorl pattern there. And then the other thing here, that was basically what I showed you from here. These are representations of my schematics, that's all of what I did, no big deal. And then how do you position it? One thing I was noticing for the people in the lab was they were doing things, randomly making recipient sites with a patient like this. Position your patient correctly for optimal results. And do the same thing with your inanimate objects. You know, position it the way that you would with the way you would do it in an OR. If you're doing a hairline design, you want the patient supine, because that way you can easily get this area with the scalp very low and your hand's not trying to go like this. Well, when I work on the crown, I have the patient sitting up for most of it because I can easily get a higher angle and I don't miss the back, because when they're lying down, you may, oh my God, I miss half the crown because they're lying down. Sit up, make sure you see and outline the bottom part of the crown so that you don't misgauge where your crown is situated, because I've done it where I've worked on the top of the crown and go, oh, I've got more crown than I thought below because I didn't see it down there. So always look there. And then if you're having trouble going and getting down on the side, position the patient in a way that you can leverage that. The point of this is the front is priority 1 and crown is priority 2 in most cases. I now do what's called mega sessions where I'm doing 3,000 grafts in one session and doing the whole area, but you should not be doing that for 2 reasons. Number 1, your staff won't be able to place 3,000 grafts most likely for a long time. Number 2 is you're not the limitation. You can harvest and make the sites. They can't transplant it. You're going to have grafts that are all mangled, not placed, dying, so don't do that. And second of all, you don't have the skills to try to leverage how to design such a wide area. You may overcreate density here, lack of density here, and you have the smattering of garbage that looks fake and doesn't create a visual effect. So those are 2 problems here. So these are just some of my results to show you clockwise. One, the rounding you see what I'm talking about now from the side view, the impact it has. This is a guy that's had a scalp reduction and multiple transplant results. This is just one transplant. Even though it's not super dense, it creates enough to cover the scar and fixes what's called a slot deformity. Unusual shapes that you can fix. Diffusion patterns, which you heard about with the different patterns that exist for women, fixing that. Finer grafts look still very good, and an upper arc, which means that most of this goes in one direction, which almost acts like the mid-scalp, right? Because there's no whirling effect, because only the upper half of the crown that's involved, which makes it much easier to create visual density. Plug correction, okay? And then you're just using PRP and A-cell that works well, which is my next talk. So be creative, think creatively. It's very, very important to do that.